Welcome back everyone. So in this video we are going to learn about pharmacodynamic interactions, but in the previous video we have already dealt with the antagonistic and the synergistic effects. So in this video we are going to learn about alteration of electrolyte levels. So in this digitalis glycosides and diuretics will be using. So generally there will be a problems when we use diuretics, the diuretics like the thiazide diuretics. So these will lead to excessive loss of potassium, means the hypokalemia will occur. And so when we are using these medications, these drugs, we should be very careful its usage with the digitalis preparations, because it may lead to certain drug interactions. And edema is often troublesome in patients with CHF, and it may increases the potassium depletions. It may increases the potassium levels, and the heart may become more sensitive to the effects of digitalis, and arrhythmia may occur. So next is the alteration of the GIT flora. In these anticoagulants and antibiotics we are using. So these interactions occurs due to the interference by the anti-infective agents like the tetracycline, chloramphenicol, neomycin, etc., with the production of vitamin K. These vitamin K by the microorganisms in the GIT. So these the problems will occur in the patients with generally the low dietary intake of the vitamin K. So it means that the microorganism of the GIT, they'll produce vitamin K, and it will get affected with the use of tetracycline, chloramphenicol, etc. So next is the miscellaneous drug interactions. In that the drug interactions are the drug food and the drug herb. So drug food interactions, these are generally the effects of the in these generally the effects of the drug will be getting altered due to the presence of certain food items. So these food items will alter the effect of the drugs. So this may be called as a drug food interactions. So these interactions are well known and potentially dangerous interactions between the medicines and the food. And these interactions occur. So example for this is the monoamine oxidase inhibitors. The monoamine oxidase inhibitors such as the phenelzine and the tyramine containing foods. So example for this is banana. So the MAO inhibitors like the phenelzine and tyramine containing foods like the cheese. So here the food items in which the high level of tyramine is present. So what they'll do, they'll and the high levels of tyramine will result from metabolic blockade by the phenelzine, which precipitates a fatal hypotensive crisis. We have already seen this tyramine plus MAO inhibitors will lead to hypotensive crisis. So the same thing. So these MAO inhibitors are the drug, and the tyramine is mainly present in the food. So this the drug plus food lead to a drug food interaction. So because of these drug food interactions, because of some medications which do not some because of some food so because of some drugs which react with food, leads to drug food interactions. Due to this, the therapy which we people are giving to the patients, it will get altered, or it will lead to the failure of the therapy. An example for this is the phenytoin. When it is given with enteral feeding mixtures, it leads to decrease in the GI absorption. So here the interaction will mainly due to the this calcium and the other divalent cations. And the other causes for toxicity will be including the high fiber diets, where it increases the warfarin activity and leading to the impairing the absorption of vitamin K. And the most very important example is the grapefruit juice. The constituents of grapefruit juice will inhibit the GIT metabolism of medicines, which are handled by the cytochrome P3A4. So this will be getting altered or directly inhibiting its metabolism. And some other food ingredients will also exacerbate the side effects of the medicines. So example for this is the chili will inhibit the substance P. Due to this, it leads to increase in the incidence of coughing in patients on AC inhibitors. And these drug food interactions are generally under recognizable, and they are infrequently reported. Next is the herbal drug interaction. These the concurrent use of the herbs, they may increase, they may decrease, or they mimic the effect of the other drugs. So generally the herb drug interaction here, the herb is not going to react directly with the drug. The constituents which are present in the herb are going to react with the drug. So the potential for herb drug interaction. So in this here see, there will be no chemical reaction between the herb and the drug, but the component of herb, they will increase or decrease or mimic the effect of the other drugs, and amount of drug present in the bloodstream. And these may be toxic intrinsically, and when they are taken with combination of other preparations. So if we take these medications in combination, so these medications with the drug, it may lead to toxic effects. And the herbal drugs, like they contain the contaminants like incorrect species, the insects, the pollen grains, etc. They may cause the toxic reactions. And reasons for herbal drug interactions is the proper information is not available, then the product information may be incomplete, and these herbal products may contain the phytoconstituents which are not compatible or which are not characterized properly, and lack of adequate knowledge of combinations. And the mechanism for herb drug interaction is same. It will be of two types, the pharmacokinetic and the pharmacodynamic. Pharmacokinetic will be divided into four types, the ADME, and the pharmacodynamic will be additive or antagonistic, etc. These are the drugs with potentially serious drug interactions. Means the mechanism will be the narrow margin of safety. In that, the examples will be including the antiarrhythmic drugs, antineoplastic drugs, and for extensive metabolism of certain hepatic enzymes. In that, the alprazolam, the corticosteroids, HIV protease inhibitors, etc. And these barbiturates, carbamazepine, phenytoin, these will come under the mechanism of induction of certain hepatic enzymes. Next, these are the methods through which we can check the drug interactions. These are the books: the Handbook of Non-Prescription Drugs by Annie L. Hume, and this Stokely's Drug Interactions by Claire. Then the Side Effects of Drugs Annual, and then these Drug Interaction Facts 2015, the Drug Interaction Analysis and Management 2014. So these are the medication. Other than those, here are some of the journals and the books or articles are here through which we can check the drug interactions. And other are the softwares. These are the softwares through which we can check the drug interactions. The first one is the drug bank. In that, we just have to include enter two or more than two medications or drugs, and after that it will give the drug interactions. Even we can enter the drug plus any food item, and then it will give the results of any, if any drug interactions or drug food interactions are present, it will give. And even we can enter the drug and the herb also. So these are the checkers, these are the software through which we can check the drug interactions. And these are the cases. In these cases we are discussing about the drug interactions, and we are managing also. Thank you.